Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. In the past few weeks, the Centers for Disease Control and Prevention has greatly expanded recommendations on the use of COVID-19 vaccines. Millions of U.S. adults are newly eligible to receive booster shots, and at long last, children ages 5 to 11 years can now receive COVID-19 vaccines. With me today is NFID Medical Director, Dr. William Schaffner, to help put it all in context for us. So Bill, thanks for joining. A long list of questions, a lot of issues.
Yes, let's get to them, Marla.
Perfect. So certainly there have been many changes in recent weeks. Can you help bring us up to date on who should now receive a COVID-19 booster shot and who may do so?
Well, let's try it. Let's start with people who've received the mRNA vaccine, Moderna or Pfizer, and it's been 6 months since their second dose. If you're 65 and older, you are eligible for a booster. You should get one. If you're 50 to 65 or through 64, and you have an underlying illness that puts you at risk for more severe disease, you bet you should get a booster. We're working our way down the age ladder. Now, if you're 18 to 65 with an underlying illness, you may receive a booster, but have a discussion with your healthcare provider. The reason it's may is that younger people are not waning in their immunity as much as older persons are. And then, of course, if you're a frontline worker, if through occupation you are contacting lots of people face to face, if you're in healthcare, if you're in a school environment, if you work in grocery stores, et cetera, or if you're living in a circumstance where you're in a congregate place where you have very close attention or association with other people, you may also be eligible for a booster. I will tell you, particularly this last section could be interpreted very, very broadly. One of my colleagues made a little bit of a joke who said, gee, that means only hermits aren't eligible for a booster. But think about that and talk to your doctor. Those are the mRNA vaccine recipients. If you've received the J&J vaccine, that was originally one and done. We now know it's one and not quite done because their protection seems to be waning more rapidly. So if you've received the J&J vaccine and it's been 2 months since you've received your vaccine, you should get another dose.
Great. Thank you so much, Bill. So can you also help us understand the change in policy on mixing and matching vaccine types and which vaccine should individuals receive?
Right. Now, suppose you got Pfizer vaccine and you discovered when you went to the pharmacy looking for a booster, they only, for one reason or other, had Moderna vaccine. Yes, you can mix and match, as we say. You could get the Moderna booster. So that's very easy. You could swap those two, and there's not much to be gained by swapping or not swapping because both vaccines in that circumstance will provide a high-level boost. The question becomes a little more important when you talk to J&J vaccine recipients. If you follow up with a second J&J vaccine, you will indeed get a boosted antibody response that's very satisfactory. However, if you get boosted after your J&J initial dose with one of the mRNA vaccines, Pfizer or Moderna, you will get a much larger boost in your antibody levels. There's no official recommendation that you should mix and match, but lots of practitioners have been giving this information to their J&J vaccine patients, and many of them have elected to get an mRNA booster for that reason.
Interesting. Let's shift gears a little and talk about children now, the newest group. So COVID-19 tends to be milder in children compared with adults. So frankly, why do children need to be vaccinated against COVID-19?
That's a very important question, and I'm sure it's one on the minds of many, many parents, because it is true that children are less apt to be seriously affected than adults. But that equation was changed somewhat and substantially, I would say, with the arrival of the Delta variant, because it began to make young adults and children much sicker than before. And as a matter of fact, in the age group in which vaccine is now recommended just recently, 5 to 11 years of age, think of this. Over 8,000 children in that age group, 5 to 11, have been hospitalized with COVID in the United States, a third of them requiring intensive care unit admission. And very, very sadly, I have to tell you this, as of last week, 94 children age 5 to 11 have died of COVID. Many of these children were normal children. They did not have underlying illnesses. And I think for those reasons alone, children should be vaccinated against COVID. I would add a couple of other things. There are sequels, downstream events of COVID that are important. Long COVID, even after mild infection with the COVID virus, and also this multi-system inflammatory syndrome that can occur a month to 2 months after COVID. Those things have really concerned pediatricians. We can essentially eliminate all of those if we vaccinate children 5 to 11, and of course, 12 and older also. So the American Academy of Pediatrics clearly, along with the CDC and many other organizations, strongly urges the vaccination of children now who are eligible, age 5 and older.
Really important points, Bill. Thank you. Carrying on to that, so some parents have really expressed some skepticism about COVID-19 vaccination, and they're pointing to concerns that have been raised about potential risk of myocarditis. So what should parents really know about that?
Of course, the skepticism and the desire for more information is entirely normal. And please ask your pediatrician or family doctor. Myocarditis is an inflammation of the muscle of the heart, and it has occurred rarely among young adults and older teenagers, particularly males, particularly after the second dose. It's really pretty darn rare. And fortunately, the vast majority of the individuals affected have gotten better very, very quickly. Nonetheless, it is a serious adverse reaction, and if that concerns you, talk to your doctor and get good advice.
Great. Bill, any thoughts on when COVID-19 vaccines will be available for children less than age 5? And what can parents and grandparents do in the meantime to help protect their families?
Well, for sure, everybody's interested in that. And I would think by sometime during this winter, the clinical trials in children 6 months up to 5 years of age will have been completed. And we'll get the results then, and we'll see what the recommendations are. In the meantime, if we go through the woods to grandmother's house at Christmas or at any other holiday, and those youngsters younger than 5 are among us, please continue to be careful. Hug them, but hug around the waist. I would suggest if you get close to those children, continue to wear a mask. I know that's tedious, but it is important. And of course, everyone 5 and older should be vaccinated.
Great. As always, Bill, this is really helpful. Before we sign off, I'll just ask, is there anything else that you'd like to make sure that people know?
Well, I would say a couple of things. The first is it's influenza vaccination season. That's that other nasty respiratory virus. And the recommendations there are very clear. All of us 6 months of age and older should be vaccinated against flu each and every year. So let's do that. And then, as we do gather for the holidays, everyone who's eligible for vaccine, whether it's flu or COVID, please take advantage of those vaccines. They'll protect you and they'll protect your family members also. Let's all get vaccinated before we get together.